Hi, my name is Yvette, and this is my intradermal injection skills video. First, what we're going to do is we're going to gather our supplies. I have my gloves, my gauze, my alcohol pads, my medication. I have my needle. I have a 1 ml syringe with a 25 gauge needle. That's 5/8 of an inch. I have my hand sanitizer, my sharps container, and my patient. So first we're gonna do is we're gonna compare our medication. So it looks like the doctor has ordered a TB test for this patient. This is a oh my gosh, I can't say. Tuberculin skin test, 5 TUs over 0.1 ml given intradermal for 1 dose. The bottle that I have here is exactly the same dose. I have our tuberculin 5 TU per 0.1 ml. So we're going to give exactly 0.1 ml to the patient. So first what we're going to do is we're going to come into the room. We're going to provide for privacy. We're going to introduce ourselves to the patient. Hi, my name is Yvette. I'm going to be your nurse today. It looks like the doctor is ordering a tuberculosis skin test for you. This is to see if you've ever been exposed to oh my gosh, tuberculosis, okay, or TB. So what, can I have you confirm your name and date of birth for me? Jane Smith, January 1st, 1950. Perfect. Do you have any side effects to any medications? No? Thank you. Okay. So we're, so yeah, the doctor ordered tuberculosis for you. This is going to take a couple of minutes, maybe like 5 minutes. I'm going to give you your shot. You could feel burning or tingling when I give you the shot. But other than that, do you have any questions for me? No? Okay. So what we're going to do, you could possibly have some side effects of swelling or itching at the site. Some adverse side effects that we would need to be aware of. If you experience shortness of breath or hives, those are very important that you let us know if something is wrong, okay? Okay, so what we're going to do is we're going to perform hand hygiene. And we're going to apply our gloves. All right, and we're gonna do is we're gonna first clean our medication. Again, we're gonna compare our medication I have here. Tuberculin 5 TU per 0.1 ml, and we're gonna give 0.1 ml. Exactly how it's prescribed on the bottle, okay? I'm gonna wait for that to dry. And I have my syringe here, and again, I have a 1 ml syringe with a 25 gauge needle, and that's 5/8 inches long, okay? So first we're gonna do is we're gonna measure for air. We're gonna take out 0.1 air. And then we're gonna inject that air into our vial. We're gonna flip it over and we're gonna make sure we take out 0.1 and go slowly. We're gonna check for bubbles. If we do, we're gonna flick our syringe to take away those bubbles. All right, and then we're gonna recap, and with one hand. Perfect. Then we're going to show this to the camera. All right. I have 1 ml. No, I don't have 1 ml. I have, give me a second. Give me 2 minutes. 0.1 ml. Okay. So what we're going to do is we're going to, again, ask the patient if it's okay. So we're going to look at the injection site, make sure that everything looks well. So for this injection site, it's going to be on the right or left forearm usually is going to be 3 to 4 fingers from the AC space, antecubital space, and about 1 hand over from the wrist. So it's going to be right in this spot right here. Okay, so we're going to look at this site, make sure that we're going to check the skin integrity, make sure that everything looks well. There's no signs of infection or anything that's jeopardizing the skin. So we're going to start from the inside in, and we're going to work ourselves out to clean it with our alcohol swab. And then we're going to leave it there. We're going to give it a second to dry. And then with our needle, we're going to make sure that we're going to go to, for this shot, we want to go at a 5 to 15 degree, and we're going to be entering about 3 milliliters deep. No, 3 millimeters, yeah, in deep. And then we're gonna want to get a wheel. It might be hard to see the wheel here, so we're gonna uncap, and we're gonna grab the skin. Okay, we're gonna pull back the skin, go there at a 15 degree, and then we're gonna do underneath the skin, and we're gonna slowly pull out, check slowly, and then out. We're gonna see our wheel, and then we're gonna again get rid of this injection into our sharps container. We're gonna put a light gauze and apply absolutely no pressure on this one at all. Once we check this site and everything looks okay, we're going to completely leave it alone. We're gonna gather up our supplies. We're gonna remove our gloves. And again, we're gonna help assist the patient, make sure they're good, give them a call later if needed. So we're gonna make sure we leave the room. Again, and we wanted to make sure that we gave this to the right patient, check drug dose, time, documentation, check the skin and everything. We're gonna make sure we leave, clean up our supplies, leave, and document this procedure. And we're gonna thank our patient. Okay, and that's it. Thank you.